Every time I hear the contact tracing people come on and say like, oh, we call you guys, we call people twice a day. We call you guys every day to check up on you. That is not true. It is very much a false statement.
Describing public health as unaccommodating and unreachable, Dededo resident Jonathan Blas and his family of 4 are COVID-positive patients who have been on home isolation since the start of the month. On October 3rd, Blas received his COVID-positive results. 6 days later, he was contacted by Department of Public Health.
We didn't know we were going to get it. So my household only had a limited supply of food. So we were calling public health because we needed to find out, like, what can we do? Like, we don't have enough, food to last us, for the whole, 10, 14-day quarantine.
Also calling for some guidance.
The first 2 days when I found out, I broke down and I started crying because I have underlying health issues. I thought this was it. Like, I was going to die.
Blas says once public health reached out, the agents told them should their mild symptoms change drastically, then go to Guam Memorial Hospital. Public health also informed the family if they provide cash, then an agent will go grocery shopping for them. However, Blas says they did not have cash on them.
We were advised to ask, somebody outside of our home to pick up our groceries, drop it off in the front of our doorstep, and then, and pretty much that's how we were supposed to have it done. So luckily we had, friends and family here that we could reach out to.
And it wasn't until after a week in home isolation that Blas says he received a call from DPHSS contact tracing team. However, he already took matters into his own hands.
She was like, well, we're going to reach out to your employer. I was like, well, I said, my employer knows that I tested positive. I said, I literally had to reach out to them because nobody did. I mean, days later, people can be all infected in my work because of me.
It's been issue after issue, as Blas explains now 20 days later, and one of his siblings have yet to be cleared from home isolation because public health has dropped the ball.
I know that the files are being thrown around because they lost, one of my other, somebody else in my household, their file got lost, and they're still under quarantine. You need to reach out or have a better system because I think their system is failing us.
Blas expressed multiple inquiries he has for public health.
And so my question for everybody is, if public health and CDC is mandatory temperature checks, and that if you're over 100, when not since the whole 20 days that I've been positive, not once have I broken a fever, not once. So does that mean that the people in the public right now who are walking around can possibly be COVID-19 carriers and not have fevers?
KUAM has reached out to DPHSS Public Information Officer Janela Carrera for a response to Blas's concerns with home isolation procedures. We have yet to receive a response.